for those of you who have not been through this kind of a training before, we welcome you to stay on, and we will go through that training in a shortened form, but with enough information to give you a sense of what it's about, and then encourage you to sign up for more training as we go forward. Does that sound good, Paula?
It does, absolutely.
Okay, so I'm going to turn it over to Paula to give you a welcome, and we'll go from here.
Thank you, Mark. For those of you that I haven't met, my name is Paula de la Riva, and I am a program officer at First 5 Kern. I am actually a participant to the second cohort of the training that Mark mentioned. So if we haven't met, I look forward to meeting you in the future. So what we wanted to do initially with this conversation, go over the meeting objectives of what it is that we're doing. It's been quite a while since we've met. The first cohort met in 2018, and then the one that I attended with some of my coworkers was in 2019. So it's been quite a bit of span, and we've lived quite a bit since then. So for today's meeting objective, what we wanted to do was to provide an update of how far Kern County has come. And that includes any funding or any changes that have happened specifically in our road to becoming a trauma-informed care county. There's a lot of good news, but we always, as always, love to hear your input because this is not something that is geared by just one agency or a few agencies, but it is needed input from everyone. We wanted to offer our assistance, especially as we're coming through COVID and reconnecting directly with clients. So what does that look like? And the challenges that we've all faced in trying to provide those continued services through COVID as well. And again, to renew our commitment to becoming a trauma-informed care county. This is supposed to be a forum so that we can connect with old friends and new ones and to share those experiences since that time has passed. And to ask for your advice as to your needs and the next steps that we should take for training. What does that look like on the layout, not only for you, but any of your colleagues that you've come across, as well as how to continue serving our community and to changing that system. And to plan for a large, in the end, the big conversation towards the end of today's session will be to have a discussion on planning a large conference where we can bring all of those relevant topics, perhaps bringing speakers so that we can continue our work into that trauma-informed care county. I did want to, before we started, was to acknowledge a couple of things. First and foremost, thank you for your engagement and your commitment to continuing to evolve personally and in your environment, and to continue to embrace becoming a trauma-informed care county. And since your participation in either of those cohorts, if you were part of that, the world has changed greatly. We went through, first and foremost, a pandemic that none of us could have ever imagined. And secondly, the social unrest that our country is coming to grips with. So as we share experiences of what that means for our clients, we always want to acknowledge any trauma that you personally may be experiencing and to provide you the resources of how to deal with that. Because if you can't have those needs addressed in your world, your job becomes much more difficult. So as always, we definitely want to refer you back to our website, which is resilientkern.org. Any type of training that we've had over the last year and a half, we've made an effort to record it and to share it on our website. So that can always become a resource for you. So with the conversation of, since we have quite a varied group of those who attended the cohort versus those who didn't, we want to go over that discussion of what does a trauma-informed care county mean? And anytime you'd like to jump in, Mark, please feel free to do so, or give us a recap of those sessions.
Sure. Well, the background to ACEs, and that's adverse childhood experiences, goes back many, many years to the mid-90s. We began to hear more specifically about that in 2016 and began doing training around ACEs and trauma and toxic stress, specifically in our medically vulnerable care coordination project meetings. And that evolved into receiving funding from Kaiser Permanente to hold 2 large cohort trainings of 100 people each. In 2018 was the first. It was 4 full days in each year, 18 and 19. And we hope to continue doing that outreach work with the organizations who participated. And fortunately, we had about 30 different community organizations, both public and private, who participated in those trainings. And we trained over time between 2017 and now. We've trained about 400 people in the basic concepts of ACEs, of toxic stress, its impact on families. And today we're really moving into a whole new area because of new funding that Paula will be talking about. So those trainings were focused in on the idea and the impact of ACEs on us as individuals, on our families, and also on our clients, members, and patients that we serve. And with that, we also were looking at ways to ease the burden for the providers themselves. You yourself, we spent a lot of time not just exploring the ACEs, but also self-care, the impact of ACEs and secondary trauma that an individual can face when serving families and individuals with a lot of trauma that they bring into your office, they bring into their conversations. And we were also looking to change policies and procedures related to how trauma is dealt with in the organizations. So go ahead, Paula.
Thank you, Mark. And I think the big picture as we start discussing what our progress has been was a quick acknowledgement that when First 5 Kern partnered with all agencies to provide these 2 trainings that were developed by Mark and Lisa Conradi, there wasn't a big push from the state as we see now. So I definitely think that it has been an exhilarating ride for most of us to see that the work that we've been doing for the last few years is piecing together with what the state is now pushing and what you'll hear. So in 2019, Governor Newsom appointed California's first Surgeon General, Dr. Nadine Burke-Harris, and she has been the largest proponent on what trauma-informed care is, as well as implementing ACEs. So having those 2 cohorts go to it has been a wonderfully timed situation in us trying to move the county in that direction. So what you'll see, hold on, give me just a second. So as Mark mentioned, in addition to what those 2 trainings that were provided, and since the appointment of Dr. Nadine Burke-Harris at the state level, and her experience as a pediatrician in Northern California, she really saw the correlation of how trauma and those ACEs, or adverse childhood experiences, can really impact an individual's health, whether it's through actions or the toxic stress that an individual goes through their entire life. So since she's been appointed, the state has made available several funds so that it becomes a policy-driven system. And it's starting at the level of a physician's office. So the funding that recently First 5 Kern applied for and has been granted is a 6-month planning grant that allows us to work with Medi-Cal providers who at the basic level or at the policy level are implementing or providing the ACEs tool to their clients. In order to get physicians to participate, the state is providing a reimbursement for each score or each assessment that is providing. In our role of the planning grant is to bring together the physicians, increase the number of those providing them in Kern County, but also in turn providing them an opportunity to know of what services are connecting them to the services that are available in the county. And that includes you. That is making sure that a physician who sees maybe perhaps the patient manifesting in not taking medication or missing appointments, the reality of a physician's office to be able to connect with that family on a different level and say, what's going on, what's causing the, absence of appointments or medication or whatever it may be. This provides it for an inclusion of a system that the physician or their staff can refer that family to case management services or to services that can help reduce the stress level of family. So what we are trying to accomplish is not only bring those physicians to the table, but then on a bigger goal to bring them to a system that they have easily access to what your services provide. And through this planning grant from now until July, that is what we are working on. And so what we would like to do is to have the network of your services and your diligence in providing those services to the families of how to connect them. That includes perhaps bringing on a system that allows us to connect the family or the physician's office to your services directly. And we're doing that through a system or a data management system called Unite Us. As some of you have heard, they've been making the rounds at collaborative meetings and sharing what their services are. And part of that is the ability for us to all be a part of that system so that when a family does need services, there isn't a disconnect somewhere along the line. So as you can see, what we want to do is have that preparation so that the system is connected so that when physicians' offices need to connect them, we have it ready to go. Any other input you'd like to have, Mark? Please jump in at any time.
Nope, I think you're taking us where we need to go.
Okay. So the reason that we really didn't have a conversation about expanding on trauma-informed care was really the conversation of let's talk about where you are at in providing those services. Since we were hoping that the majority of the attendings would be participants of the last two cohort trainings, what's happened in your life, in your agency? What kind of changes were you able to make through those after taking those training sessions? What is it that you were able to accomplish right up to the pandemic? And then share with us what that has been like, because your conversation and your input really drives a conversation on a county whole. So as we're finding out, it looks like there's quite a bit of you that didn't participate in that conversation, in those two cohorts. Your input could also be if you've had any training that's dealt with trauma-informed care, and anything that you would like to see from us in the future as well.
And what I would add as well is you chose to attend this meeting, and we will honor that as we go forward for those of you who have not gone through the training. But you chose because you had good reasons to do that. So we're going to do a quick breakout group, and Paula will define how long that's going to be, but share with those other folks in the breakout group why you joined the call today and what you're looking forward to. And then we'll come back and share those results, and we'll go on from there.
Okay, give us just a minute. Oh, thank you, Hector.
Paula, how long do you want me to keep the folks in there?
I think we should do, let's do 10 minutes for now.
Okay.
Thank you. Right, did we get everybody back?
I think so.
We had some really great conversation.
Oh, no. Group number one was a lot better than your group.
Well, I'll tell you what, our group has already set the trainings, the conversations for the year. We're good.
All right. All right. Go
But
ahead, Paula. Sorry.
I did want to ask if any of the ladies wanted to report out, just to share, give you guys an opportunity to. No. Okay. So our group was comprised of Charlene, Diana, Danica, Fila, and Daniela. And the majority of us had already taken or were part of either cohort 1 or cohort 2. But the first 5 current staff doesn't really fall into the equation. So Danica actually had really great input as far as what she was able to implement, and she took the courses. But as a group, we had the discussion of what it means in the future for this team or these individuals is definitely having follow-up discussions or a place so that these conversations can happen. What is working? What isn't working after attending the cohorts 1 and 2? What is helpful when you go back and try to implement some of your agency changes or even departmental changes as a standing meeting? So check-in opportunities as a group so that we can all share together. And another suggestion was obviously having refreshers, going back to that initial, obviously we can't set up the 4 sessions all over again or have it every so often, but having a refresher on what trauma-informed care is and how we're applying it in our own work is a great opportunity for us to make sure that we're always going back to that original source so that we know how to implement it in our jobs. Mark's group, anybody want to?
Well, we had a really great group. Alejandra was on, and Kathy, Ameta, Gaudi, Jessica, and Sulma. And all of them, except Ameta, and to a certain extent, Kathy, are new to this subject. And they really want to, if I can speak for you, they really want to learn so they can help the clients that they see and talk with, because we have a couple of attendees who are from 211. So doing it over the phone's a little harder sometimes. But no, I think we've got some very strong, committed people who want to learn more. So I promised we'd continue with those who want to continue with the training that they would like to participate in. So I'll turn it back over to you, Paula, but maybe does anybody want to add any comments to that from my group? Ameta, you were pretty vocal. Do you want to share your thoughts?
I just just commented that I think it's important that with the ACEs that as we learn more, it'll give us the opportunity to empathize with our clients, and also it's not so much what happened to them, but I'm sorry, we're able to now I'm getting nervous because I'm put on the spot.
Sorry.
But I'm just really excited to learn more information about ACEs, and also because one of my roles is to enroll our clients in the Black Infant Health Program, use that information to help our moms and better case manage them. Yeah. Yeah.
Thank you. I'm sorry I put you on the spot.
You did a wonderful job, Ameta. I think though that these conversations are really highlighting what we've known about Kern County and all the service providers, is that the heart is there to provide the best services for your client and for the residents of Kern County. And the second thing is that we definitely need support in everything that we do. And that includes being able to provide those services in a very compassionate way. So I think as we continue to have these discussions, we're reminded that there's just as many as we trained in the first two cohorts, there's many more in Kern County that want to reach out and be part of those trainings. So for us, what does that look like as an organization that is supportive of that, but in turn has convened a leadership committee that is comprised of several organizations that are taking part in this conversation? You know, what do we do as far as the training for additional people? And the task of making sure that we provide it in a way that is accessible to as many people as possible. And that in turn, it's not just the training, but it's that supportive work afterwards. You know, convening these special, standing meetings where you have an opportunity to share with each other, because we always, we have collaborative meetings that we all attend in the county, but usually they're pretty scripted, and it's all about, getting to share what services we're providing in the county. And that opportunity to really talk about and saying, I've tried this in my office, it's not quite working, I'm not getting the response, can you share what's been working for you? So that emphasis, or that importance in being able to have those convened meetings, so that we do have those opportunities to share amongst professionals, is really important. So for us, the next steps is obviously trying to figure out what a training for individuals that have never taken trauma-informed care training at all, and what ACEs is about, and the way it's being implemented at the state level. And then in turn, trying to find a space so that we can meet hopefully on a consistent basis. And your feedback will be important in that. Is it once a year? Is it twice a year? Figuring out all that information will be important to hear back from you. So definitely, again, those peer-to-peer conversations or sessions, the trauma-informed care trainings, and whether it's a new or refresher, as we had discussed. And then in turn, we want to make sure that we're bringing everybody, or giving them an opportunity to convene, hopefully once a year, which is a conference. And that is hopefully the goal of putting together a conference, whether it's bringing in speakers, or just what is the new topic, or how is his trauma-informed care being addressed as a whole. So we definitely would like to have that input as well on what a conference would look like for you. So we will, Mark, do you have any thing you wanted to add?
No, I think this conversation is a beginning point for us. And since we're reconnecting with people who've been trained before and new people, they may feel as if it's, you know, some people may feel as if, well, I can't participate the way I'd like to because I haven't been through the training, and others, I'd like to build on what I did. I don't know if you talked about what our plan was when we started 2020 and then COVID hit. But we had trained, say, 300 people at that point, and we hoped to go back to those 30 organizations who had gone through that training, spent a whole year together over a 4-day period during those years. But we were in big rooms talking to everybody. There was lunch served, well, breakfast served, then big meeting in the morning, and then lunch, and then afternoon until 4 o'clock. It was, they were heavy trainings, but we were trying to accomplish a lot in those 4 days. And we even had Judge Marquez, who was then with the juvenile court, part of those groups. She took 4 days out of her schedule, a very, very busy schedule, and participated so she could bring ACEs awareness to the court. And part of that job that everybody went through during that year was looking at their own organization through the lens of ACEs. So where I feel as if 2020, what we wanted to do was to bring all those organizations back together and say, how did it go? As Paula said, how did it go implementing ACEs? Did you change any policies and procedures? Are you using more ACEs training? Are you being more trauma informed? Have you even changed the way, say, your lobby works? The lighting in the parking lot? The interactions with each other? Do you take time for self-care in your day? And that's what we wanted to do. And then all of a sudden COVID hits and we're all at our wits' end as to not only how are we going to continue the trauma-informed Kern County work, but how are we going to even do our work if we're sitting at home and our clients, patients, members are doing the same? So it's almost, I feel as if it's like my grandkids who haven't been able to go to school as they did in the past. It's not a lost year, it's a different year. And I say to the older ones, you survived COVID as a student. You'll be able to tell your children and grandchildren about it. I don't think they believe too much in that, but the point is that we as professionals have hopefully survived it and hopefully not lost any loved ones during the year. And so as we take up the mantle again, as Paula said, the ACEs Aware grant kind of injects this whole new approach as we approach medical doctors, because we didn't have a lot of medical practices participating in those trainings. So we're actually connecting the dots the way our Surgeon General would like to. She looks at ACEs and she looks at the effects of ACEs on individuals, on their metabolism, on their genes, and how that gets communicated from generation to generation. And if you haven't been through that training, we'll cover it in a little while today. But where we stand is at a new crossroads together, and we hope that we can have you continue in this conversation. The conference is a great way to do that. And so your thoughts, and they don't all have to be shared today, but as we go forward, would really be important to guide us in it, because you know better how your organization has handled COVID and how the post-COVID world is going to look, and how the folks that you serve are looking at the world. There are some things that are silver linings in COVID and some things that are definitely nightmares that may continue for a long time, especially for people who have lost their jobs and those jobs may not be coming back. So we have to work at this together. We have to be in it together and help each other learn and help each other apply what we're learning and be open to those conversations. Challenge each other, but support each other, I guess, is a good way to look at it. Is that kind of what you're thinking, Paula?
Absolutely. And that's the key, is just reminding each other that we're all in it together and supporting each other in this whole process.
So where should we go next, Paula?
I think that we, if anybody would like to have input on what they would like to see in a conference. Any topics that they would like to see as we start discussing putting together a conference.
I think they would like to, but they don't want to be the first one. And I won't do what I did to Annette. I won't call you out.
I'll be first.
All right, Fila, why don't you
Maybe-
introduce yourself?
I am Fila Batiste, coordinator of MVCCP, Kern County Public Health Department. I would think in a conference, maybe somewhat of a review of exactly what the trauma-informed care covers, maybe some ways or some things that have been useful as far as instituting this program at some facilities or locations that have already instituted using and incorporating this into their care. I think that's something that can be covered, because those that may have never been a part of the program or the orientation, that would be useful for them to, it would even help, I think, to understand how you are to institute it or how it's to be used. Because even if you're given the information, sometimes a person says, okay, I have the information, but how am I to implement this into my daily work? So that may be a good idea.
Great.
It's an excellent suggestion, bringing on a panel of a couple of agencies to show how it started with their staff, and then in turn departmental, and moving up the ranks to see how it's transformed their services. Absolutely.
And if folks are trying to speak, what I did on the fly here is create the same question where folks can either text in their answer or use go to slido.com and put in this code, and folks can kind of, jot down your memory or jot down your answers. So we heard from Fila, a panel, right, that really talks about trauma-informed and how those principles are implemented. Other things that folks would like to see at a trauma-informed and ACES conference?
Maybe an update on seeing how the medical community is implementing, the idea of physician's office, and how for them, most of them is the first time that they're actually referring individuals to outside organizations. Is usually the idea of going to the physician's office, it's taken care of medically, and that concept of getting the community involved to provide other services, whether it's a direct service of trauma-informed, case management, referrals, food referrals. The likelihood of a physician's office doing that is pretty rare.
I wrote it in the chat, and that would be to have the larger county agencies, and I'm thinking of public health, human services, mental health, and possibly Kern Regional Center sit as a panel, so one rep for each, and they present how they are collaborating using a trauma-informed lens. And that topic, I think, could be very instrumental in having people understand where they are with using a trauma lens and how they work together, specifically around cases that are that require, you know, more than one agency involved. It might be housing and food insecurity, but it might also be transportation to medical appointments. It may be childcare, as well as mental health counseling. So they say that we spend 80% of our time on 20% of our cases. And that usually means those 20% are the more difficult challenges that are being presented. That doesn't mean that we try to do them by ourselves. And so that's part of our ACEs Aware approach, that we use the Kern Connected Community Network to bring more participants on, more agencies aboard. Any last thoughts, Paula?
No, I'm taking in the comments. I think these are great suggestions. It definitely gives us a starting point to start formulating not only the larger outlook of trainings, but bringing everyone together to have those working work groups, but what that conference could potentially look like with their help.
Great. So should we move into the next part of the session and do the training that those who are not trained yet can learn from? And those who want to stay on, we encourage you to stay on. Sometimes a refresher is a good thing. But we promise you we will be done at the appointed time. We won't take you any longer than what you signed on for. Does that make sense?
So let me take a few seconds to pull up, or do you have that PowerPoint, Mark?
Hector's got it teed up.
Perfect.
We've been working behind the scenes while you've been holding down the fort. Can we go back one slide or two, Hector? Yeah. So, all right. So what we're going to do is cover a lot of ground, and we're going to kind of take this through the ACEs knowledge and bring you up to date as to what the state is trying to do. That's our big goal this year. And I promise you that there will be a lot of meat in this. So we're going to go through a few slides, quite a few slides, but I think it will give you a really good overview. I want you to understand that the beginnings of this conversation came from us trying to serve medically vulnerable infants and children, that MVCCP project you see on the left. And then we evolved into what we now call Resilient Kern. We had in the middle focused on a trauma-informed Kern County. We thought it was not a very positive message because people are very resilient. They have to be, because there are a lot of challenges that people face in their everyday lives. So we really focus on the resilient part. Next slide, please. And I won't go through this list, but we have over 50 partner agencies that you can read about, because we can send this PowerPoint on to you later on. But those 50 have been have joined over the last 12 years. And that really reflects on the commitment that people have to work together, to collaborate, and to help coordinate their services. And we meet once a month. We still meet once a month on the first Thursday of the month at 9 a.m. and still via Zoom. So if you'd like to participate in those meetings, they last an hour. Just put your name in the chat and we will send you an invite for the next meeting on May 6th. Next slide, please. When we started this conversation, trying to help children who are born prematurely and their parents, we really had to get our hands wrapped around what's the system look like. And we realized it's a very complex system. On the left side, and we won't go through them all, this is what mom faces even before she has a child, even before the child is diagnosed with medical vulnerability. That left-hand side, it's community services, it's their doctor, it's human services, potentially education, preconception care, etc. But then in the middle, that red diamond is when that child or their child has one or more diagnoses that could impact the needs that that child may have before they start school, before they even leave the neonatal intensive care unit. And so that incorporates everything from Kern Regional Center, if they have special needs, to California Children's Services, if they need specialty care in one of our specialty care hospitals, like the one in Madera, or down in LA at UCLA or CHLA. But it can also include a lot of specialists in their lives. And we've been very, very fortunate that Valley Children's over the years heard our call, heard our plea that we needed a local clinic. And so they opened in 2018, or 2019, I guess, maybe 18, they opened the Eagle Oaks Center, not far from Cal State Bakersfield, where a lot of their specialists are there for the day-to-day meetings and follow-up appointments that families had. Before that, people had to travel every single appointment up to Madera, for example. Now with COVID, there are a lot of things that are being done through FaceTime and Zoom, but every other procedure, a surgery, anything in the specialty care that's not just a follow-up, for the most part has to travel. And that's where parents miss a lot of appointments as a result. So we spend a lot of time analyzing this system, analyzing where the gaps are, and advocating for changes. Along the way, though, what we found was that we weren't answering all the questions. It was a deeper question. That's when we found out about ACEs. Next slide, please. We found out that there are 3 types of trauma that people experience. And this was something that came out of research done by Kaiser Permanente and the Centers for Disease Control. There's acute trauma that lasts one time. That could be a car accident, terrible car accident that causes physical trauma and mental trauma. There's chronic trauma. That's experience of multiple traumatic events, often over a long period of time. And then there's complex trauma. That's used to describe a specific type of chronic trauma and its effects on children. Those are what we look at as ACEs, adverse childhood experiences that are caused by adults who should have been caring for and protecting the child, or in the course of their own lives have caused trauma without even knowing about it. So acute, chronic, and complex. And if you look at the clients you're serving, some of them may be experiencing acute trauma. They may have had several different events, or they may be carrying a heavy burden that goes from complex trauma into toxic stress. Next slide, please. So what does a trauma-informed Kern County mean? This is something that we talked about earlier. It's where the whole community, including you going through this training and applying it back in your office or with your work, it's how the community thinks about and responds to children and adults who have experienced or may be at risk of experiencing trauma. That's why we have a first alert system with abuse and neglect, for example. We impose the requirement that if you hear about somebody going through abuse or neglect, you must report it. Those are requirements that teachers have, or nurses have, or doctors have, for example. And we want all of Kern County to be trauma informed to understand the prevalence and impact of adverse childhood experiences and the role that plays in people's lives and even across generations. And we'll talk about that. But also the complex and varied paths for healing and recovery. As I said, it's not a death sentence. When we hear about ACEs, it's actually an opportunity for a conversation that may take time, but we shift our thinking from what's wrong with you to what happened to you. Next slide. So I love this slide because it says so much, and I recommend that people, when you get this PowerPoint, print this one out and have it next to you so that when you're reviewing a case, you're actually analyzing, without having done an ACE screen, you're actually analyzing what your client may have gone through by looking at these kinds of ACEs. We call the pair of ACEs. There's ACEs, adverse childhood experiences, and then there's adverse community environments. And both of them play into how people handle the world and handle life. Some of them they can control, many of them they can't. So we look at maternal depression, and a lot of our moms after having a baby go through that. But they may also have experienced emotional and sexual abuse early on in their life or later on. That may have led to substance abuse. They may be experiencing domestic violence, homelessness. They're experiencing the pain of physical and emotional neglect, where people in their lives are not spending the time or listening to them. They may have gone through a separation or a divorce. They may have mental illness, and they may have family members who have been incarcerated for a short period or a long period. Those are what we call adverse childhood experiences. And there's actually a screening tool of 10 questions that address that. But then there are additional questions that are associated with the adverse community environments. And that's what I said to my group earlier. When you drive down the street, after you hear this, you're going to look at the world differently. You will look at the signs and activities that impact poverty, that cause poverty. And certainly we're very familiar with discrimination and racism. And we've gone through in our country, as Paula said, a world of opening up those conversations because in many ways, because of technology, as we learned about that very, very brave teenager who filmed the George Floyd death with her phone. Without that video, the world would not know what the true story was. And that's part of what we as a society have to reckon with. It led to community disruption to really make the point that this is not okay. We've also learned to articulate more and more ways the lack of opportunity and economic mobility and social capital. Redlining, where people have not been permitted to live in certain neighborhoods, has reduced the amount of economic mobility that families can pass on to each other. Poor housing and poor control over their housing when they're renting, if their landlord is not taking care of their responsibilities. And in California, affordability is a huge issue. And then finally, the violence that breaks out in communities all over the country. And we've seen a rash of renewed gun deaths and shootings as a result of over the last few weeks, not even, and including the last few days. So those are the pair of ACEs. And the better awareness that we have, the better ability that we have to balance that conversation when we meet with people. Next slide, please. So we call this toxic stress. And if you have time, go back to the archives in the Pennsylvania, into the Bakersfield, California newspaper. Go online and search for toxic stress articles. They published 4 of them back in 2016 and 17 or so. One of them had this map in it. And when we look at toxic stress, it really shone a light on life expectancy that is diminished and drastically diminished as a result of toxic stress. That's the carrying around of all this experience from childhood into our adulthood and how it impacts our ability to listen and learn and maybe not learn. The poverty that they've experienced, which has led to not seeing the world as a friendly place. And that toxic stress, as I shared with my group earlier today in our breakout group, is that fight or flight syndrome that we carry through every day, not just when we're under some short-term stress. And what this shows is, by the coloration in the Kern County map, is that we have some people who are living well into their 80s, and many people who are dying in their 60s and early 70s. They're losing out on anywhere from 10 to 15 to 20 years of their lives because of the toxic stress that they carry. Next slide, please. What we look at are adverse childhood experiences and these social determinants of health that were in our pair of ACEs. They're looked at as economic instability, the neighborhood and physical environment, and how it plays into our ability to be healthy, to be happy. If we don't have clean and accessible parks and safe places for children to play, if we don't have walkability, even in the heat, there are cool parts of the day when people will walk and will join groups and walk. And we need to have more of those things. But if you're unemployed, you're in debt, you've got medical bills, and you don't have a great environment, it can impact our ability to learn. And so education is impacted. Our food, our hunger, our access to healthy options in our neighborhoods. And then the social context of all of this. Do we have leaders in our communities and opportunities to be part of a community? If we don't, because of discrimination or lack of social integration, it can impact our ability to be healthy. And then finally, our healthcare system as a whole. We've been fortunate to have the Obamacare over the last 10 years or so. But even during COVID, we saw a lot of people drop out of it because they were afraid to take advantage of it because it would be held against them if they weren't citizens of our country. Or even people who are working didn't sign back up again because they were afraid their family members who are undocumented could be held against them when they go for citizenship. So, but these are the social determinants of health. This is another one besides the pair of ACEs that I encourage you to print out and have available. It leads to a higher mortality rate, lower life expectancy, higher costs because we wait for an emergency before we go for regular health care. And we're not able to enjoy life, in other words. Next slide, please. So when you get the slide from us, we'll share, but these are some of the things that I've been talking about, and they kind of capture it in one slide. What we do know that people of color are much more highly affected by hypertension, by a 60% higher rate of diabetes among African Americans than white Americans. And a lot of these impacts are tied to the death rate during COVID. So I encourage you to print this one out and have it available to you as well. I think many of them you're very familiar with, but I want you to kind of take those and learn more. And as we do more trainings and you take advantage of those, you'll be able to apply them. Next slide, please. So what's the impact of different factors on risk of premature death? Well, it's complicated. When we start with genetics, it's 30%. But what we've learned from ACE's research is that some of that genetic impact is as a result of ACEs that have been carried forth from one generation to another. They get embedded in our gene structure. And there's a slide with a short video that I hope to show you as we go further. 40% of it is impacted by individual behavior. Do we choose to smoke? Do we choose to use drugs, to overuse alcohol, to not eat healthy food? Well, some of that's tied to our ability to pay for better food, and not just use fast food. But some of it is choices that we make because as young people, as teenagers, carrying a lot of stress around, we look for outlets and we use risky behaviors to escape from some of that stress that we're experiencing. As we talked about social and environmental factors, clean air, clean water, and living in the Central Valley and the air quality is something that we have to be very, very mindful of. It's difficult to escape. But then our healthcare itself, do we take advantage of our annual checkups? Do we do colonoscopies? Do we follow through with our doctor's advice? Sometimes we can and sometimes we can't because of our situation. But they do impact our death rate and our premature death rate. Next slide, please. So what's the impact of this? This is one way to look at it. Overdose deaths. We're very familiar with the Oxycontin epidemic that our country went through. And that just exploded in the last 10 years or so because of a lot of factors, some of which was engineered by the pharmaceutical company and some of their supporters in the investment field. We just saw that the Purdue Pharma are hoping to get away with just a $4.5 billion penalty, as they were the primary distributors of Oxycontin. So that's one example, but here's another example, the next slide. This is where overdose deaths were in 1999 on the left, and look at how it grew into 2015. I don't have a more recent slide, but we know that it grew. And those overdose deaths weren't just Oxycontin. It was when that became too expensive, people went to cheap forms of heroin and meth and had overdoses as a result of that. So if you tie it back to adverse childhood experiences and how that has impacted along with the adverse community environment, it combines to very much make it difficult for people to overcome unless they have the support system that they need. Next slide, please. So what California has done is to take this up not just a notch, but to really make it a priority by the state. And we're the first state to really invest the kind of approach into our healthcare and tie those together and not just separate them as, well, that's somebody's problem and we'll treat them on a fee-for-service basis. We'll just look at it as one more diagnosis that we have to deal with. No, we have to look at it across the board as something that impacts all of us in one way or another, in different ways based on our own experiences, whether we have one ACE or two ACEs or 5 ACEs or 8 ACEs, that impacts us, but it also impacts those around us, our peers, our brothers and sisters, our children, our spouses or or partners in this conversation. So ACEs Aware is the first in a nation initiative that began in 2020. And we're seeing that most of the state, when you look at the map on the right-hand side, is being involved in this conversation. Next slide, please. We call it the Roadmap for Resilience. And Dr. Nadine Burke-Harris on the left was sworn in as our Surgeon General by Governor Newsom. And her experience as a pediatrician is so important in this conversation, that we don't just look at ACEs as a diagnostic tool, but we look at it as something that's rooted in core values of prevention, equity, and the rigorous scientific approach that's needed to be able to understand it and communicate it. Without that science, we can't justify our insurance companies paying for the kinds of services that are required to support families. And the goal is to stop the transmission of ACEs into our next generation by half over this generation that we are in right now. And that who are just starting out are going to see that investment and that involvement throughout your working life, we hope. Next slide, please. So again, to reiterate, we have 3 types of ACEs. We have abuse, neglect, and household challenges. And it's important to kind of keep our eye on them. Physical abuse, emotional abuse or neglect, and sexual abuse. I want to share with you how ACEs was discovered. Back in 1995, 96, we had a doctor, Dr. Vincent Folletti in San Diego, who for many years, ran an obesity clinic. And he was very successful. Now, what he discovered, though, was that a lot of his patients, many of whom were female, were putting the weight back on within a very short time, 6 months, 9 months, within a year. They might have put on the large amount of weight that they had lost during their treatment through his clinic. And he was just baffled why that was happening. So he started asking, with their permission, his patients, and surprisingly, they were very open to why. They had lost the weight and they were afraid that by losing it, they would become more sexually attractive. And what they shared with him was that they had been sexually abused as children. And there's always the dialogue, should you ask a question like this, will you re-traumatize people? That's why you have to be very careful when you open up that conversation and leave the patient or the client to answer those questions. And that pertains to abuse, neglect, and also some of the household challenges, mental illness, intimate partner violence, whether or not they experienced a divorce in their family, if any of their family or themselves were substance dependent, or any family members were incarcerated. In this case, this conversation that he had with his patients who had put their weight back on opened up a whole line of investigation that led to 17,000 of the Kaiser Permanente members taking a survey. And what they found was, and these were white, middle class San Diego residents, not they were not representative of the country as a whole. And they had a substantial number of ACEs in their childhood. It wasn't poverty, it wasn't lack of education, it wasn't lack of opportunity, it was what had occurred to them. And the Centers for Disease Control started doing more and more research. And over time, there have been over 2 million surveys taken and conducted to understand the breadth of this impact of ACEs on people. One other story that needs to be told is that we did a survey, an anonymous survey in 2016 with our conference attendees using their cell phones. And about 40% of the 125 or 130 people attending took advantage of this during the lunch hour. We didn't want to take a lot of time during the presentations. We just made it a voluntary thing. So a lot of people did it, and nobody's information was being shared except on the big screen where it was aggregated, added up. And we found that 40% had 4 or more of these 10 ACEs. And yet they were in the helping profession. They weren't individuals who were so burdened with what they experienced that they couldn't. In fact, it helped them decide to help others because of their experience. And the more we've delved into this, we've learned that people who understand trauma and may have experienced ACEs themselves want to help others. They become the lifeline to many, many other folks. Next slide, please. Well, what the research has shown is that 62% of US adults have at least one ACE, but 16% have 4 or more ACEs. So when you see your patients, your members, your clients, and I say members for anybody who's from a managed care like Kern Health Systems or HealthNet or Kaiser, when you see your client, many of them have had ACEs. And what the state really wants to do is have medical providers ask the question, fill out the survey, whether it's done anonymously where they say, yes, I have 5 ACEs, or they actually articulate what those ACEs are. Dr. Burke Harris's clinic doesn't ask which they are. She just wants to know the number, because that's an important number to know. And you can see the number nationally is replicated across the state. Next slide, please. So the key finding from this is ACEs are causally associated with toxic stress response. Next slide. That's what the research shows. Prolonged activation of the stress response system, back up, can disrupt the development of brain architecture and other organ systems and increase the risk for stress-related disease and cognitive impairment well into the adult years. We are seeing that people who suffer from Alzheimer's have a higher number of ACEs in their childhood and early adulthood. In addition to ACEs, other risk factors for toxic stress include poverty, exposure to discrimination, and exposure to the atrocities of war. This is a very important finding. And by the way, for those of you who are nurses, you probably know this. It's not new. African-American women experience a much higher prematurity rate with their children, even if they are middle class or above. And it's because of the exposure to discrimination and that constant stress that they are carrying on a day-to-day basis when walking out the door, walking down the street. We're, as a society, confronting that much more openly and broadly. And the hope is that the younger generation is going to carry that knowledge and into their world every day as we go forward. Next slide, please. So the stress response can be either positive or toxic or somewhere in the middle. That's what we were talking about before. If it's positive, and I mentioned the example of an athlete saying, many of them do, I can't play well if I'm not a little nervous about the game. It's the natural physiological response. We need a little stress. We can't be so laid back that, well, I don't know if I'll go to work today, or I don't know if I'll feed my kids today. That's not a real good. We need to have that challenge so that we rise to the level of our abilities. On the other hand, we don't want to be so toxic that we're responding in a maladaptive way. And that prolonged activation of the stress response in children disrupts the brain architecture, as we said. So for example, when children go to school and they're in that toxic stress range, they're not sitting there listening to what the teacher has to say necessarily. If they feel as if the world is not on their side, is not really where they want it to be. On the other hand, if they find the teacher is a very welcoming individual, someone who listens to all of her or his students and engages with them and finds out maybe a little bit of their story and uses that to calm them down or guide them with their homework and things like that, that helps a lot to have that mentor, that coach, that aunt or that uncle or that sibling, and most especially with that parent who comforts them every day and guides them through, because maybe they have knowledge of what that's like to live. Sometimes we hear stories from some of our attendees in our trainings about the bear. The bear in the woods is one that you know how to deal with. You either run from, which isn't a good idea necessarily, or you confront by screaming at them, by pounding whatever you can on the ground, stamping your feet to scare them away. But sometimes the bear is who comes home after work and starts drinking and maybe starts hurting individuals in the house, or so dominates in their neglect that no one feels that they're being listened to. That's the bear that is toxic. Next slide, please. This is what we call a biomedical effect of toxic stress. It's that chronic toxic stress living in a red alert mode for months or years that can damage our bodies. It means that we have a constant presence of adrenaline and cortisol. That's not good. That leads to a weakened heart and circulatory system with high blood pressure. It can lead to high glucose levels that develop into type 2 diabetes, higher levels of cholesterol, and most important, an inflammatory effects on our immune system. Inflammation from that red alert state is one of the things that impacts our lifespan, our ability to live long and prosper, as they say. Next slide, please. Can we activate this? This is a very short but powerful. I can't hear it. Can you? No sound. Okay. Well, what this is saying is, just play it out. I've seen it enough. It shows a child being comforted. It's by the parent when they start to cry. And if a child is not being responded to that way, it really affects their ability to trust what's in the world. And there we go. The extended absence of response from adults can activate the stress response system. It overloads the developing system with serious lifelong consequences for the child. That's toxic stress. Over time, this results in being on permanent high alert that affects their learning, their reasoning, their emotion. It's hard enough growing up, but if it limits the neural connections that comprise our brain architecture, it can lead to less learning and less of ability to prosper in our life and be the kind of person we want to be. We should be growing new ones. And what we find is when we're comforted that we can regenerate those neurons by having a nurturing, stable environment. So thank you. Next slide, please. So when you do your work, you're being that person, that mentor, that comforting person, that guide. So we can avoid building the pyramid from adverse childhood experiences, the disrupted neurodevelopment, the social, emotional, and cognitive impairment, those healthy risk behaviors that sometimes people take on, and disease that you just saw come out, and early death. Next slide, please. So when we have a dramatic increase in the risk from ACEs, it leads to a much higher level of these physical conditions, from heart disease, cancer, even accidents, because we're not paying attention, because we're not concentrating. And as I said, diabetes, but also we see kidney disease, and very apparent in the last few years, higher levels of suicide, particularly among older white individuals, but also younger folks from 18 to 35 who are killing themselves. Next slide. It costs a lot because we're not using the knowledge of ACEs to address these issues. Next slide, please. So does it mean that we're doomed if we have a high ACE score? Well, resilience means that we can bounce back when we're faced with a variety of challenges in our lives. Our brain is plastic and the body wants to heal. So we will grow new dendrites and neurons and connect those synapses, even when toxic stress has been there, but now it's stopped and it's replaced, because rather than risk factors, we have protective factors. And I have to share with you, when we did that survey among our people in the conference, we had a nurse who's a good friend who has 7 ACEs, who didn't even know she had 7 ACEs, because she had grown up in a very loving environment. So it tells a lot about the individual if they're given a chance. Next slide, please. It is a health condition amenable to treatment. Next slide. So we need to provide new opportunities to interrupt the toxic stress. That's what the ACEs Aware goal is and our grant is about, but also this training is about. If you never hear again about what the Surgeon General is trying to do, and we hope you do, we hope you'll join us, we hope you'll take advantage of it. The knowledge that you can interrupt the toxic stress response in your everyday work, in your everyday goings on when you talk to people. And that the earlier the intervention we do with infants and children, young adults, it makes a huge difference by preventing the transmission of neuroendocrine, immune, metabolic, and genetic disruptions in children. Next slide. So the key protective factors are a connection with a caring adult. If you're beginning to learn what your client has experienced, it won't happen overnight. It won't happen in the first meeting. But when you open up that conversation and ask about them, rather than just say what you can provide and go down the checklist, you'll find that you'll get a better response and better outcomes. Parental warmth makes a big difference, but also we need to advocate for safe, cohesive neighborhoods. We need to encourage parental resilience, and we do that. First Five does that with parent education sessions at our family resource centers. We need concrete support, and that's through our medical practices and our county agencies, our schools, but also our churches, as well as in our workplaces. Next slide. These are some of the things that ACEs Aware encourages. They call them stress busters. So quality sleep and good nutrition, some physical activity. And we're learning that just 10 or 15 minutes a day, you don't have to be a weightlifter to be healthy, but 10 or 15 minutes a day of even slow walking, but just getting out can change our mindset. But also good breathing exercises and other mindfulness practices can really help. Access to nature makes a big difference. And then good mental health care. That's self-care as well as seeing a counselor when needed. We're reducing the stigma that's attached to that, but these are the stress busters. Next slide. So the key findings is that we need to have a coordinated multi-sector strategy to advance prevention in our public health, but also across all of our services for early detection. That's through the ACE screening or the ASQ that is done at 211, the Ages and Stages questionnaire, and then to really learn about how the science is advancing this conversation. If we didn't know through science, we wouldn't be as far along as we are, and we're still we have a ways to go. Next slide. So strong work is already occurring. We have great need for coordination, and we do a lot of coordination in Kern County. As Paula talked about before, we have a lot of coalitions, and you may belong to some multidisciplinary team meetings. That's great coordination, but we have to balance it with better knowledge of how to advance this. Next slide. So our key finding, one for today, is an effective response to ACEs and toxic stress requires it at all levels. Primary prevention, that starts even before a child is born, when a woman sees her doctor and gets early prenatal care when she knows that she's pregnant. And secondary prevention can be screening everyone when we possibly can who has experienced different exposure and look for ways to prevent the next level of symptoms. One of the ways to do that the Family Resource Centers does is in discipline. How do parents discipline their children? They may use what they would say are old school, tried and true methods of physical discipline because they experienced it. What they learned through that training is that a comforting parent can guide their child better than using that physical imposition of discipline. And it's actually that aha moment that changes the way they view themselves as children and growing up and becoming parents, and now how their children will view their own childhood as they go forward, if we can break that cycle. And then the third level, tertiary prevention, targets individuals who've already developed a disease or social outcome. And that's where the doctors being involved makes such a difference. And combining that with mental health services can really break the cycle. Next slide. So we're shifting our view, and we know that that's why it's trauma-informed Kern County and Resilient Kern. We all have a role to play, whether it's providing for, at WIC, providing services there, to our dental practices, our Saving Smiles Coalition, and our immunization van that goes around town, paid for through First Five. We combine healthcare with public health, with social services and human services, early childhood care, education, and justice. That's the combination that we're working towards. Next slide. One example of this is many years ago, we started targeting smoking. This was considered something that we could, through the Surgeon General for the United States at the time, who quantified through science the detrimental effects of smoking, not just on the individual, but also on their partners and family members. And look at how we've reduced that level of smoking over these years. It was a public health crisis that we took on, just like ACEs is a public health crisis that we're taking on. Next slide. Lead exposure was another that we took on in the 70s. How did we learn that lead in, from baseboards, from pipes, had an effect on a child's brain? We did the science on it. We did the experiments to learn. And so we started requiring that when houses were built and painted, they would not be painted with lead-based paint, that pipes had to be changed out so that we weren't drinking water that had been coated in lead. And so again, this is a public health crisis that with science and with the public knowledge and our media messages, we change the way families live. That doesn't mean that we've eliminated lead, but completely, but we're working on it. Next slide. We've also challenged maternal mortality rates, and they've gone up and down over the last 20 years. But look at California, because we've taken this very seriously, trying to reduce maternal mortality, and look at it across the United States. And the lesson I want us to remember is, if you recall when Serena Williams had her baby, she almost died. And it was as a result of the way she was being looked at and treated in the hospital. And she took the bull by the horns and challenged them to do their job. And it changed the outcome for her and her baby, who's now starting to play tennis. The next generation. Next slide. And this reflects in the maternal deaths over the last 20 years as well. We've really challenged that, but we still have very high rates of maternal deaths in the African-American population. And that's really what Ameta is working on, with her program. So next slide. We need to help her. Critical for success is shared language, shared metrics, role, understanding our roles, and clear lines of accountability. That's part of what we're doing today, is as you learn about ACEs, as you learn about toxic stress, and you learn more about this as you take more training and process this information, we want you to be able to speak with your peers in other organizations and share your knowledge, and they will share it with them. Next slide. So our key tools in California are not just the science, but also looking at legislation and impacting training across providers and paying them a little bit more to be able to do an ACE screening so they can better understand what their patients are experiencing. And then having them connect their patients with community resources like yours. So it's a combination of factors that we're implementing. Next slide. We're just about done. This is the slide we started with. So we're impacting it through the healthcare sector and through cross-sector integration. And I want you to remember the Kern Connected Community Network that started last year. We have about, I can't remember right now, it's somewhere in the 60 range of organizations that have joined the network and are available once people are trained using the technology to share referrals. So remember that, Kern Connected Community Network. Next slide. So we have, what we're trying to do in Kern is what we're trying to do across the state. Raise public awareness. So don't forget, www.resilientkern.org. Resilient Kern, all one word. www.resilientkern.org is our website for this work. And there are other trainings available that are recorded that you can go to, and on your own, you can listen to them. We're trying to do those cross-sector trainings like this one, where we invite a lot of different people from different organizations, like the 30 different organizations that participated in 2018-19. And then using coordination amongst ourselves to better serve our patients and clients. Next slide. Is that it? I think that's it. All right, let me stop and see. We've got about 7 minutes left. What questions do you have or comments? Was this what you were looking for? Let me start with that. You can go to the chat and just say yes, or I need more, or both. We'd love to hear from you very quickly. And in the meantime, does anybody want to add their insight into this, or was this what you were looking for? I'd like to hear from somebody. Both, good. Yes.
I can't exactly say what I was looking for, but I'm quite pleased. It was very informative, and I think it was very helpful for me. It also gave me additional understanding of what I had, already learned, but it was very helpful for me.
Great to hear that, Fila. Anybody else? What would you like what would you like to be trained in next? Let me ask you that, because one of the things that we did with those 2 cohorts was, how do I take this back to my colleagues, to my coworkers, and share it with them? So we're going to give you that PowerPoint. We'll send it to everybody. But if you or your organization would like further training, if your team would like to be trained, reach out to, you got an email from Hector Gutierrez. Email Hector, he's on the call right now. Email him and say, yes, I think my team would like further training. And we can arrange that when it's convenient for your team.
Yes, Black Infant Health definitely should be trained. This is Miss Ameta.
We'd love to do that for you. Anybody else?
A question, did you make mention of there being some type of screening tool as well for ACEs? Did I hear you say that?
Yes, you heard it right.
Is it possible to share that tool or?
Yeah, it's a very simple 10 question. And I'll just say to you that our doctors who are being asked to be trained in it, there's a 2-hour training they will take, can last a little longer. It's very good. And we can share that link with you too, if you'd like to learn more about that screening tool itself. The reason I say it's very good is they have a number of case reviews they do. And you're just a participant. You're not in a big room like this. You're just going through it at your own pace. And you can actually get a certificate, even if you're not a medical provider, if you go through that training. But the point is that we can share that 10-question survey. Some clinics are using it as a paper tool. Some people are sitting down and asking the questions. Some are asking them to simply read it and give them a score or internalize it without sharing it the first time they meet with them. So there are different approaches, but the 10 questions are the same points that you saw before: abuse, neglect, and household challenges or personal challenges.
Thank you.
We have about 3 minutes. Who else? You know, I'm gonna ask Jessica Flores to share what her thoughts are, because you came aboard hoping to learn something about it. How do you think it helped you, Jessica?
I feel like it was great. It's also good, you know, refresher. I have taken a few trainings related to ACEs before, but I feel like if we're not really practicing it or just getting, you know, a brain refresher, it's just not gonna, you know,
It doesn't
always be
stick.
there.
Yeah.
Yeah, so it was definitely great. I loved the videos and, you know, the break rooms, everything kind of kept me up and going. So yeah, I enjoyed it.
Thank you. Sorry to pick on you, but I knew you wouldn't mind.
It's okay.
Anybody else? 1 more minute. Well, I just want to thank you, and thank you for taking the time. Paula, do you want to wrap us up?
How do I follow that training? Well, I definitely want to thank you, but this is just the start of the conversation. It really is, again, hearing back from all of you, whether you've been part of the trainings or not, just that continued engagement to be a participant in this change as we look forward to what that looks like for Kern County. Please look forward to other trainings that we're going to start formulating and putting together, always on the website that Mark mentioned, resilientkern.org. And invite other coworkers or other people that you know that you work with in your contact as you provide services in the county. Because the more people we start engaging with, the more quickly we can work together as a county.
And with the last few seconds, I'll say you guys signed up for this first one. The next 3 that we're doing in next Thursday, the next Thursday, and the next Thursday are the very same conversation. So you don't need to attend those, but you can tell your friends and your colleagues, hey, jump aboard one of those and you'll get the same knowledge that I got. So we want to make sure that you go back to that original email or go to Resilient Kern and have them sign up there, okay? Thank you so much. It's 7 o'clock, my time,
Thank you, Mark.
your time. We'll
Thank
let
you,
you
Paula
go
and
and
Hector.
have a great evening.
Bye, thank you.
Thank you.
Hector and Paula, do you want to stay on for a second? Diana?